Did you know your heart goes into a state of alert every time you ejaculate? That's right. The instant pleasure reaches its peak, the heart reacts as if the body were experiencing an explosion of emotion and physical effort at the same time. The male orgasm is one of the most intense physiological events there is, and the heart is the first to feel its impact. With every beat, it responds to hormones, blood pressure, and the electrical wave that sweeps through the entire body. And for a few seconds, it literally speeds up as if it were fleeing a threat. Sexual arousal, from the first touch to the moment of ejaculation, is a biological roller coaster. The brain sends nerve signals throughout the body, the penis fills with blood, breathing speeds up, blood pressure rises, and the heart races. It's the sympathetic nervous system, the same one that prepares you to fight or flee, being activated in a controlled way. What's curious is that, to the body, intense pleasure and extreme physical stress are almost the same thing. The difference is that, in pleasure, the brain mixes dopamine, oxytocin, and endorphin to turn that chaos into ecstasy. During ejaculation, the heart can beat between 130 and 180 times per minute, the equivalent of a high-intensity workout. That's why you often feel your body tremble, your face flush, and your chest pound. The heart is working hard to maintain accelerated blood flow while the brain unleashes a storm of hormones. It's the peak of integration between mind and body. But what many people don't realize is that for the heart, this discharge is both a challenge and a blessing. A challenge, because it requires effort, a blessing, because it strengthens the cardiovascular system, improves circulation, and releases built-up tension. Orgasm, when experienced in balance, is a kind of physiological reset. It relieves pressure, reduces cortisol, the stress hormone, and leaves the body in a state of deep relaxation. The heart, therefore, doesn't panic during orgasm. It vibrates, responds, and adapts. What it feels is the weight of pleasure. And the healthier you are, the better it handles this intense wave. Problems arise when there's excess, neglect, or untreated disease, and that's what I am going to show you from now on. I'm Dr. Emily Collins, a urologist, and I want to explain how your heart behaves during pleasure, what happens when it's pushed to the limit, and why orgasm is both a test and a gift for your body. But before we continue, make sure you're subscribed to the channel, because here I talk about men's sexuality with science, clarity, and no taboos. And tell me in the comments, have you ever felt your heart racing during climax? Seconds before ejaculation, the male body enters a state of total preparation. Everything happens so quickly and in such a coordinated way that it seems like magic, but it's pure biology. In that moment, the brain and nervous system work in perfect sync to guide the body to climax. The heart races, breathing accelerates, and the entire body enters a kind of controlled short circuit, where pleasure and physical effort merge. During arousal, the sympathetic nervous system, the one responsible for alert and survival reactions, kicks in strongly. It increases blood flow to the penis, makes the heart beat faster, and prepares the muscles for the intense contractions that come with ejaculation. Blood pressure rises, body temperature increases, and blood is shunted from the extremities to the most active regions, pelvis, heart, and brain. It's the body prioritizing pleasure. At this moment, the testicles lift, the perineal muscles contract, and the penis reaches its maximum rigidity. The prostate begins releasing seminal fluid, which mixes with sperm coming from the testicles. Everything is synchronized in milliseconds, coordinated by the sexual control center located in the spinal cord. The brain, in turn, enters a state of absolute focus, dopamine and adrenaline surge, the visual field narrows, hearing diminishes, and the sense of time practically disappears. It's the entire body concentrated on a single objective. The heart, at this point, is working at its safe physiological limit. It pumps blood with force and at an accelerated rhythm, ensuring oxygen and energy so the body can sustain this peak of tension. Heart rate can double within seconds, which is why the chest vibrates, breathing becomes labored, and muscles contract involuntarily. Pleasure and effort become one. This is precisely the instant the body is about to cross the line between arousal and release. The brain is ready to trigger the final command, ejaculation. And when that happens, it's not just the penis that responds, the heart, the brain, and even the entire nervous system join in a burst of chemical and electrical reactions. And it's about this exact moment, that second when everything happens, that I am going to show you now. Because what your heart experiences at the instant of ejaculation is a spectacle of biochemistry and power, a perfect dance between pleasure and survival. At the exact instant of ejaculation, the body reaches the maximum point of arousal and effort. It's as if every system in the organism joined in a single explosion of energy. The heart races, the brain enters a trance, and the body vibrates in a sequence of involuntary contractions that last only a few seconds, but consume a sizable amount of physical and chemical energy. The sensation of pleasure reflects this controlled collapse between the nervous system and the cardiovascular system. In that moment, the brain releases a wave of neurotransmitters: dopamine, oxytocin, endorphin, and serotonin. Dopamine creates intense pleasure, oxytocin promotes connection and relaxation, endorphin relieves tension and creates a mild euphoria, and serotonin brings a sense of well-being. This chemical blend makes the body experience pleasure as something absolute. Time slows, the whole body responds, and the heart beats at full power. Physically, the heart works at levels similar to an intense run. Heart rate can reach 160 beats per minute, and blood flow increases significantly. The body is literally in a state of maximal effort, only this time driven by pleasure, not fear. That's why the face flushes, breathing becomes heavy, and the chest seems to pound forcefully. The heart is trying to keep up with the brain's chemical fireworks. At the same time, blood pressure rises and the body releases a small dose of adrenaline, responsible for that slight tremor and the sensation of an energy surge. For a brief instant, the body blends pleasure and physiological stress, a duality that explains why orgasm is so powerful and exhausting at once. The heart and brain align in perfect synchrony, one pumping blood intensely, the other commanding the hormonal storm. Right after ejaculation, the body enters a recovery stage. Prolactin is released, signaling to the brain that the pleasure cycle has ended. The heart begins to slow, blood redistributes, and the body relaxes. What was tension becomes calm. And it's exactly in this contrast that the fascination of orgasm lies. It's a war and a peace at the same time. But what many men don't know is that, for a few seconds, the heart really does think it's under attack. It interprets the hormonal peak and physical effort as a risk situation, which is why some people feel strong palpitations or irregular breathing. This is natural, and it's this brief panic of the heart that I am going to explain now. When you reach the height of pleasure, the heart truly enters a state many would call panic, but in reality it's just doing what it was designed to do: react to the most intense stimulus peak the human body can feel. Orgasm activates two opposing systems at once: the sympathetic nervous system, which accelerates everything, and the parasympathetic, which relaxes. This collision is so powerful that, for a few seconds, the heart believes it's in an emergency. During climax, the body releases a flood of adrenaline. This is the same hormone released in dangerous situations, meant to heighten alertness, speed up heart rate, and direct blood flow to the muscles. But during orgasm, it's not accompanied by fear, it comes paired with pleasure. The brain mixes adrenaline with dopamine and oxytocin, transforming a survival response into ecstasy. That's why the chest seems to vibrate, the heart beats so forcefully, and in some cases even feels like it skips a beat. This reaction is completely natural. For most healthy men, it's even beneficial. The heart works intensely but within safe physiological limits. What it's doing is ensuring oxygen for the brain and muscles, which are in full contraction. The sensation of chest pressure or rapid breathing isn't a sign of danger, it's the body at its peak capacity. But perceiving this peak can be scary. Many men describe ejaculation as a moment when the heart explodes or loses rhythm. What actually happens is the sympathetic nervous system fires so strongly that the heart changes rhythm for fractions of a second. It's a reflex, not a defect. Soon after, the parasympathetic system kicks in, reduces heart rate, and causes that immediate feeling of relaxation and relief. That's why, after orgasm, that deep, almost sleepy calm arrives. The body shifts from maximum alert to a quick, intense recovery. The heart slows, blood pressure dips slightly, and the body enters rest mode. This is the so-called post-orgasmic reflex. The myth that the heart panics during ejaculation stems from confusing effort with danger. What happens isn't a collapse, it's power. And in fact, this effort is one of the most effective ways to train the heart and keep the cardiovascular system healthy. Of course, there's a limit. For those who already have heart disease, uncontrolled hypertension, or circulation problems, this peak can be a challenge. And that's what I'll show you now, when pleasure, which should be beneficial, can become a risk. For most men, orgasm is a heart-healthy discharge. But for those with cardiovascular disease, that moment can be a dangerous test. During ejaculation, the body reaches a level of physical effort comparable to an intense run or climbing several flights of stairs quickly. The heart has to pump blood forcefully, blood pressure rises, and heart rate skyrockets. If there's arterial blockage, arrhythmia, or heart failure, this overload can trigger serious symptoms. Men with cardiac problems usually feel clear signs when the body exceeds its limit: chest pain or tightness, shortness of breath, dizziness, off-rhythm palpitations, or extreme fatigue right after climax. These symptoms indicate the heart is struggling to keep up. The risk isn't in sex itself, but in the intensity of the physical response. For a healthy body, this acceleration is natural and safe. For a weakened heart, it can be too much. Understand that pleasure activates the same mechanisms as stress. The difference is the body's intention. The sympathetic system releases adrenaline, the heart speeds up, and blood is directed to the genitals and brain. In a balanced organism, the parasympathetic quickly follows, promoting relaxation and a return to baseline. But in those with cardiac dysfunction, this transition can be slower or incomplete. The body stays stuck in alert mode longer, which raises blood pressure and the risk of arrhythmia. That's why, for men with a history of hypertension, angina, heart attack, or arrhythmia, regular medical follow-up is essential. Sex, in this case, should be viewed as physical activity. If the heart isn't ready for intense effort, it needs strengthening first. Medication, dietary changes, and stress control help prepare the body to enjoy pleasure safely. And here's something few mention: erectile dysfunction is often the first sign of heart problems. The arteries in the penis are smaller than those in the heart, so when circulation starts failing, the first symptom often appears in erections. The body warns before it breaks down. The good news is that for most men, sex and balanced masturbation are not only safe, they strengthen the heart. Orgasm releases endorphins, lowers cortisol, and improves circulation. The key is respecting the body's limits and treating pleasure as part of health. And that's exactly what I want to talk about now: why sex, when lived in balance, is a natural exercise that can protect your heart and increase your longevity. Few people realize it, but orgasm is one of the most powerful natural workouts for the heart. It doesn't just release pleasure, it trains the body, balances hormones, and improves circulation. Each time you reach climax, the heart speeds up, blood flows more strongly, blood vessels dilate, and the entire body syncs up. It's a mini physiological marathon that lasts only seconds but brings deep health effects. During arousal, the cardiovascular system works similarly to a high-intensity workout. Heart rate climbs, oxygen circulates faster, and muscles get an extra energy boost. When orgasm arrives, the body releases endorphins and oxytocin, substances that reduce stress, improve mood, and relax blood vessels. The result is a healthy drop in blood pressure right after climax and a sense of well-being that spreads throughout the body. This response is extremely beneficial for the heart. Men who maintain an active, balanced sex life tend to have better circulation, less inflammation, and more stable cholesterol levels. Sex, like conscious masturbation, helps keep the vascular system trained, preventing arterial stiffening and promoting vessel elasticity. It's the body caring for itself through pleasure. Additionally, orgasm improves sleep quality and regulates cortisol, the stress hormone. And when stress decreases, the heart works more lightly and efficiently. Balanced pleasure, experienced without rush or guilt, functions as a natural therapy for the nervous system. It calms, stabilizes mood, and helps control anxiety. But the secret is balance. Just like any exercise, excessive or uncontrolled pleasure loses its benefit and turns into wear and tear. A man who masturbates or has sex compulsively doesn't give the body time to recover. It's like training the same muscle every day without rest. The ideal is to respect the body's rhythm to feel, recover, repeat. The heart loves pleasure, but it loves balance even more. Sex and conscious masturbation are, in fact, ways to reconnect body and mind. And it's this harmony that keeps the heart strong, desire alive, and vitality high. And this is where I want to take you in this video's conclusion, to show you how pleasure and the heart form an inseparable duo. Next, you'll understand that the heart doesn't fear pleasure, it vibrates with it. After understanding everything that happens in your body, it's clear, the heart and pleasure have always walked hand in hand. Orgasm is an explosion of life, and the heart is the maestro conducting that symphony. It feels every emotion, responds to every stimulus, and vibrates with your body the moment pleasure peaks. For a few seconds, it works like never before, and that's exactly what keeps it strong, alive, and resilient. During climax, the heart speeds up because it's being challenged, and challenge is what keeps it healthy. It's the same logic as a muscle that grows when stimulated. The difference is that, in pleasure, the fuel is desire, not effort. The heart pumps blood, the brain releases dopamine and oxytocin, and the body enters a state of perfect harmony. In that instant, pleasure and survival become the same thing. But there's something even more beautiful about all this. Pleasure shows that the heart isn't just a blood pump, it's also a mirror of your emotions. When you're relaxed, confident, and connected, the heart beats in a natural rhythm. When you live under stress, guilt, or hurry, it suffers. And that's why conscious, balanced sex is one of the greatest acts of love you can give yourself. It's the physical translation of inner peace. I'm Dr. Emily Collins, a urologist, and I see this every day in my practice. Men who arrive tired, anxious, and drained, and who discover that part of the problem isn't in the physical heart, but in the emotional one. When they learn to balance pleasure, the body responds, the heart strengthens, and the mind calms. Because pleasure and health aren't opposites, they're allies. So the next time your heart races in the middle of pleasure, don't be afraid. It's not in panic, it's alive, pulsing with you, celebrating what's most human about your body, feeling. If you've made it this far, congratulations, it shows you want to understand your body and care for your health consciously. Now, subscribe to the channel, because here we talk about men's sexuality with science, clarity, and respect. Leave a like if this video made you look at your heart differently and comment below, my heart is alive. And for those who stayed until the end, the next video is already on the screen. There I explain how testosterone directly influences your circulation and why desire and the heart are more connected than you imagine. Click and keep going with me, because understanding your body is the first step to truly caring for what keeps you alive.